Hello out there. How is your weekend winding up? I hope your Sunday is very fine. Thank you so much for joining us. This is Woman 360, and today I'm at the heart of UTH, which is the Cancer Diseases Hospital. We are talking about cancer, we are talking about breast cancer, we're talking about cervical cancer, and just cancer that affects women. I know cancer affects men and women, but let's concentrate on the woman for now, just to know how exactly we as women can tackle this cancer. How can we know that this might be cancer? What should we do when we have cancer? And of course, thank you so much for the feedback that you've been giving us on Facebook. Thank you so much for the encouraging words as well. I am getting so excited as everyone is getting so interactive and getting in this jive of Woman 360. On the program as well today, we're going to be talking to Chove, who is going to tell us how can you take care of natural hair. Why natural hair specifically? Well, we are embracing our Africanness, that is one, but specifically for this episode is because, you know, if you've gone through chemotherapy, you want to take care of your hair, you want it to be natural, you can't put chemicals and whatnot, but how are you going to take care of that? So I'll be talking to my very special guest for today right here at the UTH, who is Dr. Lishimpi. He's going to tell us details of cancer, how you can tell what is cancer, and of course he's also going to try and clear some of those misconceptions that we have had as women. I know some time back there was the immunization that was introduced, the vaccine for grade 4 girls. Now it received a lot of feedback, both negative and positive. Other people were happy, but others were saying no, not my daughter, she's not going to do that because there's all these issues and misconceptions of maybe she might be barren, why at such a young age. He's going to be giving us answers to all that. Well, let's just go to Dr. Lishimpi and see what he has for us. This is Woman 360. I'm Judy Ngulube.
You're welcome.
All right. We'll start with the basic one. What is cancer?
Cancer is, by definition, it is an abnormal multiplication of cells in the body that begin to multiply uncontrollably, and they become immortal, meaning they don't die but they continue multiplying, and they gain the capacity to invade and displace other normal cells, and they form a lump, a growth, and with time they also begin to travel to far parts of the body from where they start from. So basically that's the hallmark of cancer. It's an abnormal proliferation of the cells that is uncontrollable and with the potential to spread to other parts of the body. But if, say, a cancer arises from the breast, then we call it breast cancer.
Okay.
If it arises from the lung, then we call it lung cancer. If it arises from the brain, we call it brain cancer. And then within the brain or within the breast, it will also have the type of specialized tissue it arose from. Okay, whether it is a lobular structure, whether it is from the ductal structure, we say ductal cancer, lobular cancer, but it's all breast cancer. Then we begin to separate them, make them more specific. There are some mesenchymal tissues in the breast, so we will call that after that name, but we know this is from the breast. So it depends where it is. If it's from the mouth of the womb, we call it cervical cancer. If it is from the womb itself, we call it endometrial cancer. If it is from the ovary, we call it ovarian cancer. If it is from the vagina, we call it vaginal cancer. If it is from the vulva, we call it vulval cancer. If it's from the penis, penile cancer. If it is from the anus, anal cancer. Okay? So these are just nomenclatures that we use to try and differentiate sites because they are different in their own rights.
Okay.
Yeah.
What if we narrow it down to women, where we talk about breast cancer and cervical cancer?
Mm-hmm.
What are some of the symptoms? If I'm just a woman at home, I know we're told to touch here and there, but how can I tell that this isn't an abnormality?
Yeah. So basically we need to understand one thing. A woman's body and a man's body are only different in a few areas. Okay? men have breasts as well, except that the woman's breast develops much bigger than that of a man. So males also have the propensity to develop breast cancer. And we have seen men with breast cancer here at the hospital.
Okay.
Yes. And the only difference then between man and woman are the reproductive structures, where the female have unique structures and the male have unique structures. So when we say women's cancers, we are more referring to the cancers that are related to the reproductive structures of the women, including breasts. Okay, so we are looking at breast cancer, we are looking at vulvar cancer, we're looking at vaginal cancer, we're looking at cervical cancer, we're looking at endometrial cancer and ovarian cancer. Okay. Now, of these unique cancers for women, in Zambia, cervical cancer is the commonest, followed by breast. Then the others will follow. Okay? So, when we now talk about the symptoms of cervical cancer, the symptoms of breast cancer, or what are the causes of these, in general, for all cancers, both men and women put together, we have a group of risk factors that we must always remember that predispose individuals to developing cancers. First, there are things that we can't change. If you are born in a family that is predisposed to developing certain cancers, you are also likely to develop that particular cancer.
So cancer can be genetic?
Yes. Okay? In about 15 or so % of the cancers we see, they are familial. Okay? Then comes the age. It's something you also cannot change, because no matter how much plastic surgery you do, you will still grow old. And cancers, the older you get, the more prone you are to developing any cancer. Then you've got the whole range of modifiable risk factors. 1, obesity. 2, smoking. 3, lack of exercise. 4, eating unhealthy foods. 5, alcohol. 6, there are things we share because of liking one another.
Yes.
Infections. So if you have unprotected sexual intercourse, you're going to share a lot of infections, and some of them can trigger cancers. So I've got in mind here HIV, which can be shared through unprotected sex, and we've got hepatitis B and C viruses. These are also sexually transmitted, and they can trigger liver cancers in human beings. Now, liver cancer can happen both either male or female. Then you've got the human papilloma virus. Okay? Now, the human papilloma virus is the one that is implicated in 95% of the cases for cervical cancer.
Is that why now you see postnatal, the woman after giving birth is encouraged to go for pap smear and all those?
We actually encourage any woman who has had unprotected sex, even once in their lifetime, to actually begin to go for cervical cancer screening. Yeah, because any woman who is in the reproductive age group and is having sexual intercourse may be exposed to human papilloma virus. And it is a human papilloma virus that causes cervical cancer. But it not only causes cervical cancer, it causes cancer at several other sites. So it can cause cancer in the vulva, cancer in the vagina, cancer in the mouth of the womb, which is cervical cancer. Then cancer on the penis of a man, cancer at the anus, and cancer in the head and neck area, in the throat, the back of the mouth, the voice box. Human papilloma virus can also be found there, and if it gets its way into there, it can trigger cancers developing into those sites. When it comes to the early symptoms, I'll start with the early symptoms of breast cancer.
Yes.
Okay? So for breast cancer, one of the early symptoms, there are about 3 of them that I probably would emphasize on. The first one is, for as long as you are not lactating, meaning breastfeeding,
yes,
or you're not pregnant, you're not expecting a baby, when you press the breast, you know, you press the breast from the base,
Okay.
and you come to the end towards the nipple. Observe what comes through the nipple. Usually it is clear fluid. That doesn't make any problem. It's okay to have some clear fluid come out of there. But if this fluid is bloody, blood, stained with blood,
From the
then
breast.
there is a problem. Okay? If you are above 40, you must report at the hospital. They can do a mammogram, or they can do a clinical breast examination for you. If you are below 40, you go to the hospital, and a trained nurse or a trained doctor or clinical officer should examine that breast to see if there are any lumps they can find. So the next symptom is a rash around the nipple. A scaly, dry rash around the nipple that comes and goes, comes and goes. You buy all sorts of fungal things, and they treat you with this and that. Is coming and going, coming and going. That might be another telltale sign that there's something growing in that breast. Then you can also feel a lump yourself. If you are able to do what we call self-breast examination. Now, self-breast examination is a technique we teach people, lay people, women and men in the community, of how to be aware of what is normal in your breast.
Okay.
And you do this once every month. For males and women who are postmenopausal, meaning that you are no longer having your periods, you can choose a single day in the month. The 10th of every month, I will examine my breast. So that's when you use, you look in the mirror, you look at the skin, you look at the level of the nipples, and you try and lift your hands like that. You see how the nipples are going up and down. If one of them goes higher than the other one, then it means the one that is lagging behind, either there is something growing which is making it heavier than the other one. So when you start, obviously the nipples will not be in the same line. So you yourself now needs to know that my nipple on the right is higher than this one.
One breast is bigger than the other.
Correct. Yeah. So you yourself need to know that, and as you do this motion like this, and you're looking in the mirror, and you'll be able to see that, and then using the flat palm of your hand, you can actually feel the breast. Okay. For lay people, it doesn't matter how you do it, but you must have a systematic way. You either go around this way or go around this way. We prefer to go around this way, starting with the lower inner part, upper inner part, upper outer part, lower outer part, and then you go into the armpit. So as you are doing this, you'll be able to feel if there is any lump. You can feel between the chest wall and your fingers. If that lump, if you feel a lump, then you go and tell a medical personnel at the clinic, there's a lump in this breast. Okay? And they will be able to also repeat the examination and confirm if it is true. Then we can take a small little piece of that lump by using what we call a core biopsy. It's a small special needle that we go through the breast under ultrasound guidance, get the tissue, send it to the lab to be sure to know what it is, because there are several lumps in the breast that can be there which are not cancerous.
Now that you're talking about equipment and needles, brings me to the question, the testing of cancer, either cervical or breast cancer, what is the process? Because people have all this imagination of what goes on if you haven't been.
Okay, we are talking still about breast cancer.
Yes.
The only thing we do for breast cancer, if you came, first we teach you self-breast examination, which you yourself will be doing at home. When you pick any of these three things, blood on the nipple, a lump, or this rash,
yes,
then you come, because these are very early symptoms. Then you come, and a clinician will then do a proper examination for you, because we are trained how to find abnormalities. Okay? And we do so many of these examinations, and we become very experienced. If I don't find any abnormality on my examination, it doesn't mean that you don't have anything.
Okay.
So I go ahead and say, what imaging modality am I going to use? So for those that are less than 40, I can only do ultrasound in Zambia for them. For those that are over 40, we can do mammograms where it exists. There are special x-rays for breasts where it exists. We have one mammography unit at least in each province today.
That's
as we
good
speak.
news.
Okay. Here in Lusaka province, we've got 2 in the public sector. One is here at the cancer hospital, one is at Levi Manawasa. Then Kabwe has got 1, Kasama 1, Mansa 1, Chipata 1, Solwezi 1, Mongo 1, Livingstone 1. Okay, so at least we've put them 1 in every province.
Okay.
Yeah, and those are special X-rays that can be taken, and they can show changes that are 1 millimeter size. So meaning when it is just starting, you can actually pick it up and do something about it.
Okay.
So these are the procedures for breast. Yeah. So what we have, the common symptoms of cervical cancer are the following. 1, when you have painful sexual intercourse. When you experience pain whilst you're having sexual intercourse, it's not normal. 2, when you have what we refer to as post-coital bleeding. This is bleeding that occurs after sexual intercourse. It might be little blood, it might be a little bit more, for as long as you're not having your menstrual flow. Okay? And then, of course, these 2, if you notice these 2, you need to quickly go for screening for cervical cancer, so that somebody can see what is going on. Now, the good thing with cervical cancer is that it is a process. You know, from the time you get infected with human papillomavirus to the time you develop a cancer at the mouth of the womb, it can take you 10 to 15 years. If you are not coming for screening, the changes between year 1 and year 10 will not be detected by anybody.
How often is a woman or somebody supposed to come for screening?
At least once in 5 years,
Okay.
if you are HIV negative, and if the screening test is negative.
Okay.
Okay? And also depending on what type of screening test we have used.
Okay.
Okay? So for those that are HIV negative, you can do it once in every 5 years, but we recommend once in 3 years. Okay? For those that are HIV positive, every year for 3 years. If you are negative every subsequent year for 3 years, then we give you a longer period.
No?
Okay?
All right.
Yeah, but every HIV positive woman must have, and I'm saying must have, cervical cancer screening done. The minute you know you're HIV positive, you need to have a what? Cervical cancer screening done.
What about the misconceptions that people have?
Okay, let's start
Because there were so many
from
stories.
let's start from the human papillomavirus itself, because that's where the things must start from. Number 1, there is a myth in the community to say that men are the ones who carry it. Okay? Please don't blame men alone, because human papillomavirus is carried by both male and female. And depending on the type that you have, it can be carried even on the skin. Because there are more than 109 types of human papillomavirus, and there are only about 9 that cause cancer. So depending on where they are and what you are carrying, the type, you may pass the one that doesn't do anything to your friend, or you may pass the one that can cause cancer in your colleague. If you are in that group of people where you have sexual intercourse today with this man or this woman, tomorrow with this man, with this woman, so you acquire successively different types, and you acquire it at different times, maybe this month and maybe another 5 months you'll get another one. So you can appreciate that this is going to cause you a cumulative effect to try and clear this infection in your body. So it then persists, and this is a cycle that damages the cells and starts progressing them into developing cancer. And this is a process when we are doing screening that we want to catch. What can we do to protect those people who have not yet been exposed to human papillomavirus? This is when the vaccines were created. Okay, the human papilloma vaccine was developed, and in other countries it has been used for over 20 years now. It is safe. There are very few complications associated with it, and all the issues of those, the girls won't become pregnant and what is just a fallacy. It's just misinformation. It's reasons that we, the parents, want to advance, thinking we are going to protect our children from this vaccine. Because we are ignorant. That's why they say ignorance is a danger. It's a dangerous disease, ignorance. Yes. So we need, as parents, to be aware that the human papillomavirus is here to stay, and it shall protect our children from getting cervical cancer. Okay? Cervical cancer can be gotten from multiple sexual intercourse at that time. So the idea is, when you vaccinate girls, when they become of age, they start having sexual intercourse.
Yes.
They are going to have sexual intercourse with boys. The boys will, in the beginning, there will be a mixture of women. There are those that are vaccinated and those that are not. We're not vaccinating men and boys. So all the males will not be vaccinated, but the girls will be. So the idea here is
vaccinate the boys as well?
they are also eligible to be vaccinated, but it's issues of cost.
So you have to,
Okay, we have to find something that is cost effective for our country to manage. Okay, once we get to there, maybe a middle income country, full-fledged, then we can vaccinate everyone. Okay, so the idea is to break the transmission cycle.
It's been very interesting. I've learned so much, believe it or not, just with this chat of ours.
Yeah.
And I'm sure even people out there have gotten a lot of information, a lot of data from what Dr. Kennedy Lishimbi has told us today. Let's just go to Elise Joy, and she gives us tips on how to take care of natural hair. As you can tell, chemotherapy does make our hair weak, or we just need to shave it off completely, right? And he's talked about HIV and AIDS as well, which can affect us. So let's just go to Liz Joy as I continue chatting with him, because I've got more questions. We'll see you on the other side.
Hello, my name is Joy from Elizabeth Salon Boutique and Spa. Today we're going to talk about natural hair products, or natural hair care. Now, there are several reasons why people decide to go natural. Some of them it's because of health reasons, or you just want to try something different, or because of the cost. Okay, so these are some of the examples of low manipulative styles. You don't need, for this lady, she wanted her hair straightened, so we did put a heat protector inside in the hair. Then we just straighten the hair. But when you're blow drying your hair, don't use the hottest setting, because it's bad for your hair. Then just put a heat protective lotion in the hair. Then if you're going to be heating your hair, don't do it every time, like several times a week. Just maybe if you feel like a change once in a while, you can do that. Then this is another example of a low manipulative style. A simple, you just comb the hair back, put it in a nice ponytail, nothing fancy and pulling or something. You can see on her edges are still free. It's like relaxed, there's no pulling. And if you want that sleek look in the front, that's where you put gels or edge control, just to push the hair back. Then the puff on top you can use, if you're blessed enough to have long hair that like she does, you can use that, your hair, or you can use a hair piece and just put it, as long as it's not too tight. Or if you're going, I know some brides have done this, and you put pins or things, decorations in the hair. Then this is another low manipulative protective style for hair. It's a weave, but we do what is called crochet braid. So you just, instead of using the old-fashioned, well, not really old-fashioned, but the normal thread and needle, we use a crochet hook, which is gentler on the hair. Then you don't have so many, it's not that heavy. It's really a nice style, and you can use either straight hair piece or the curly one. Usually a lot of people use Mali braid, but it's crochet. It also lasts maybe about a month or less than a month. And this one is nice because you can actually go into the hair and put lotions and things. Then we have an example here of Ngulube. with a kind of a fancy twist. And you can see from her edges, we left out some hair because we're protecting the hair. We don't, if it's very neat, it looks nice, but then you're just damaging your hair. So the edges were left it's kind of loose, and it's easy enough for you to put moisturize in your hair. And with these days, there are so many different types of ngulube. It's not the olden days where it was either straight back or just a ponytail. You can do all these zigzaggy styles. Then for her, we just deep treated her hair. We colored it. Then we did, because she didn't want fancy things, we put colors in the hair and just remove and put setting lotion, and she's like all ready to go.
I can cast a spell, secrets you can't tell.